right now, people who are moving out of the hospital are people who are waiting for placement in an alternate level of care. So many people are being moved temporarily into long-term care homes, for example. People who may have been in acute care bed for some time waiting for a placement. So instead of having their permanent placement, they're being moved into spaces in long-term care. That's the primary area. We also are ensuring that people who've had minor surgeries or had other surgeries prior to the routine scheduled surgery stopping are being discharged home as soon as possible and making sure that they have the care that they need in the community. We are not putting anybody into the Vancouver Convention Centre this week. That is part of the strategy, as we talked about. If we start to see dramatic increases in numbers of people in hospital for COVID-19, and we need to cohort them so that they are all in the area where they can receive the critical care that's needed, then we would look at moving people who had other illnesses, so people who were recovering from their heart attacks, recovering from trauma or other injuries that brought them into the hospital. If they didn't need to be accessed that close to the potential for critical care, we would potentially move them into an off-site facility like the convention center, should we reach that point. So we're not expecting anybody in the near term to be there.
And just, Rob, just to put it in context, our current occupancy is about 60.6%. Not about 60.60%, it's 60.6%. And our current critical care bed occupancy is 53.7%. The main group of people that we're not taking into hospital right now are elective surgeries, and you see the thousands of surgeries that have been canceled so far, which obviously creates significant space. In addition to that, alternate level of care patients have been moved out of the hospital. So the purpose of these alternate sites is to prepare for all scenarios. Right now, as we said in the briefing, there are 4,233 empty hospital beds. So this is creating even more capacity than that. And to do that, you have to prepare in advance. You can't decide 2 days from now you need a temporary hospital and put that together. So in all of the health authorities, we're preparing those sites. And at the Trade and Convention Center, I think I gave you the numbers. I'm just trying to recall. It was in the neighborhood of 200 additional beds, and that's a big enough site that you can, in fact, set up two separate hospitals treating two different types of people. So with 4,000 plus empty beds, we're not moving anyone there soon. But this shows our determination to be prepared for people, and also to ensure that people who may have less serious illness or recovering from treatment other than COVID-19 can continue to be separated from people who are dealing with COVID-19 in hospital, and that's going to be true in all the health authorities. The Royal Columbian site, as you know, is phase one of a major hospital renewal there, so we were about to open that site for its intended purpose, which is related to mental health and addiction programs, so we will be holding off that opening and using that site for this purpose or until it's clear we won't need it in future.